Good morning and welcome to Pediatric Grand Rounds. Is this on? Okay, great. It's always fun and delightful to have one of our own come back to give Grand Rounds. Dr. Sheetal Ejmani is a board-certified pediatrician and the medical advisor of the Benjamin Goldberg Foundation. She demonstrates expertise in clinical pediatrics ranging from well child care to neurodevelopmental and acute urgent care. In her role as the medical advisor of the Benjamin Goldberg Foundation, she curates evidence-based content that explores the integration of healing arts and integrative therapies into allopathic medicine. Her efforts are directed toward promoting holistic patient care, emphasizing the well-being of the whole individual. While Dr. Ejmani's accomplishments also encompass her role as the founder of Radiant Living Institute, the creator and host of the Essential Self-Care podcast, and co-author of the Amazon best-selling book, Doctoring Better. Today, she stands before us as a passionate advocate for the mission of the Benjamin Goldberg Foundation, which is to transform the healthcare experience through the healing arts. She completed her medical school here at EVMS, her residency here at EVMS. She has deep roots in the community and a commitment to healthcare advancement in Hampton Roads. Today, she's speaking on exploring healing arts and integrative modalities, enhancing patient-centered care. So please join me in welcoming Dr. Ejmani to Grand Rounds this morning.
Thank you, everyone. It's such an honor to be here to present this morning's Grand Rounds for you. Before I dive deep into the topic, I wanted to take a moment to introduce Wendy Goldberg. She is the founder and the president of the Benjamin Goldberg Foundation. So Wendy, could you come up and share a little bit about the foundation?
Good morning, everyone. My name is Wendy Goldberg, and as Dr. Ejmani introduced me, I am president and founder of the Benjamin Goldberg Foundation. And when my son was treated here at CHKD for neuroblastoma, starting in 2013, I was witness to the transformative power of art, music, and creative expression in his journey. It was then I realized the immense potential of these healing arts held not only for Benjamin, but for other families and children. And with that vision in mind, the Benjamin Goldberg Foundation was born. Through the foundation, we have been fortunate enough to witness the incredible impact of the healing arts programs on the lives of young patients at CHKD. By raising awareness of the healing arts programs, we can continue to expand the reach of these transformative programs and ensure that children have access to the healing arts. And as Dr. Ejmani has already been introduced, but I just want to thank you for being here. Enjoy the presentation. May the power of creativity and compassion inspire us all.
Thank you, Wendy. So as was mentioned previously, today we're going to dive into the topic of exploring the healing arts and integrative modalities, enhancing the patient-centered care. So our learning objectives for today, we're going to identify and differentiate different healing arts modalities and integrative modalities. And we're also going to evaluate the benefits and applications of these modalities within patient care. So let's just say you're caring for a patient. You've been caring for your patient for quite a while with maybe some chronic long-standing conditions. And your patient comes to you and says, hey, I am interested in trying meditation or yoga, or I've heard of this thing called art therapy or music therapy. What do you think? What comes up for you? Like, what is the response that comes up for you? Is it, oh, that's great, that sounds interesting? Is it, shoot, I don't know anything about this and I don't know what to advise you? Is it, sounds like it's not harmful? Sure, why not? But I really don't have time to look it up or get into a discussion about it. Right? What is the response? What comes up for you? Because I think we've all been in a situation where a patient has mentioned that they're using another modality that may not have fit into our conventional allopathic medical training. And so how do we respond to that? How do we also kind of open up that dialogue with our patients about this, right? We're going to go into some numbers in a little bit, where I'll show you kind of exactly how many people are using these modalities. But how do we make it comfortable for our patients to also express this to us, right? So maybe we don't have time in our clinic visit to dive deep into it, but can we at least open up that dialogue? And my intention today is to really help expand your vocabulary of what these healing arts and integrative modalities are, right? Because we have to start there. We have to start somewhere, right? These modalities are not something that we're typically trained in our conventional medical training. So I'm Dr. Ajmani, as was already introduced. I'm a pediatrician. A little bit about my story. So I started practicing yoga my first year of medical school in 2002, right here in Norfolk at the local Y downtown. And it really opened me up and exposed myself to parts of myself that I didn't know about before. A sense of peace, a sense of calm. That's also the first time I heard about something called Ayurveda. If you're not familiar with what that is, I'll describe it a little bit later in the presentation. But these seeds were planted at that time, and I leaned into these tools for my own journey, managing the stressors through medical school, through residency, through practicing as a pediatrician, through personal and professional challenges throughout life. I went on to become a certified yoga instructor as well as a certified Ayurveda lifestyle consultant. Similar to my own journey, many other physicians and other healthcare professionals who I've spoken to through informal discussions who have explored these topics of healing arts and integrative modalities have often done so as part of their own journey, have often done so as part of either having a health diagnosis themselves where they felt that they needed to explore other modalities, that they maybe ran up against some limitations within their conventional treatments and they needed to just find other modalities to support and augment what they were already doing. That being said, many other healthcare professionals and healthcare providers who I've spoken to have really sought out this information on their own time with their own resources. Started perhaps to integrate these tools within their own lives, and then from that place were able to educate their patients and speak with more confidence to their patients about it, right? So this is one of the missions that I have as the medical advisor of the Benjamin Goldberg Foundation, is to bring some of this education, bring some of this training to my peers, to my colleagues, to you sitting here today. So here's some numbers. So this is from the 2012 National Health Interview Survey. And so we know that 1 out of every 10 children use complementary therapies in addition to conventional allopathic medicine, 1 out of every 10. And we know that that number goes up when we look at adults. 1 in every 3 adults uses complementary therapies. We also know that that number goes up when we look at patients with chronic long-standing medical conditions, where up to 50% of children with chronic long-standing conditions have reported using complementary therapies. We also know that 72% of pediatricians feel that they should be able to counsel and give advice and give information to their patients about complementary therapies, but they feel like they just don't know enough about it to do so in a really informed way. So as I mentioned before, as the medical advisor of the Benjamin Goldberg Foundation, this is really my mission here, is to really raise the awareness of the healing arts and integrative modalities within healthcare spaces from a scientific and evidence-based perspective. And there's a couple ways we're doing that. One is we have every month I'm reviewing the scientific literature and I'm writing articles on the foundation's website, reviewing the scientific literature about the healing arts and integrative modalities within medicine. So that's a resource for you as well after this grand rounds ends, to continue to keep up with what the research, what the science is saying about these modalities. And then also through curating educational content like this grand rounds and a conference that we're doing in a couple weeks that I'll share more about later. So as I mentioned earlier, one of my intentions with today's grand rounds is really to help expand your vocabulary and just exposure to these modalities. So we're really today just taking a really big high picture view of these different modalities so that at least if a patient comes to you and says, hey, I'm interested in this, or I've tried this, you know a little bit more about kind of what they're talking about and what that entails, right? And then you can always dive deeper when you have time, or if there's interest, or if you see the same themes coming up with your patients, right? If you see that your patients are reporting that they're leaning towards a specific modality over another, well, then that's a great opportunity to dive deeper. But for today, we're going to do kind of a high level overview here. So I want to go through some of these definitions on the screen here. So healing arts, allopathic medicine, complementary therapies, integrative medicine, and alternative therapies, right? So I feel like as physicians and healthcare professionals, I want us to be using the correct vocabulary as well when we're talking with our patients and with our colleagues about this. So what are the healing arts? Healing arts are creative practices that promote healing, wellness, coping, and personal change. They include music, art, dance, movement, drama, poetry, and writing. What is allopathic medicine? That's what we've been trained in, right? That's what we've been trained in through medical school residency. These are evidence-based practices, right? We're following clinical guidelines and protocols. What are complementary therapies? So complementary therapies are also evidence-based therapies, okay? So they are also evidence-based therapies, and they are done in conjunction with, to supplement, to augment the conventional treatment plan, right? So it's not done instead of, it's done in addition to, yeah? So then what's the difference between that and integrative medicine? So integrative medicine is where a healthcare professional has knowledge of allopathic medicine as well as these complementary therapies and brings all of that together to create the management plan for their patients. Yeah. And then and that is also evidence-based. Alternative therapies. Now, alternative therapies are not evidence-based, and they are often done instead of conventional allopathic medicine. Yeah? So that's the one that's not recommended, right? So that's the only one out of this list of these terms here that is not evidence-based. And that is the one that is done instead of, right? So our focus here today is on the healing arts. You're already familiar with allopathic medicine, complementary therapies, and integrative therapies. Yeah? So the healing arts, let's dive a little bit deeper. So the healing arts really takes a humanistic perspective. It really sees that there is more to healing. It acknowledges the role of beliefs, emotions, stress, social connections, the environment, creativity, spirituality. It acknowledges the role that all of these aspects of life play within the healing process and the healing journey. It really builds on the belief that health is not just the absence of disease. It's not just the absence of disease, but it's also fostering self-growth, resilience, which is essentially what medicine is, right? I think through a lot of changes in the healthcare system, and we're not going to go into all of that, but a lot of changes through the healthcare system, we've really become really good at sick care, right? Bringing in the healing arts is what we've done as physicians since age-old time. This is nothing new. A lot of times we can look at these terms, these modalities, healing arts, complementary medicine, integrative medicine as something new. It's not new. This is how medicine was always practiced. But just through a lot of changes just in our lifestyles, with the system itself, things have kind of moved into being more, we're really good at sick care. Yeah? So none of this is new. It's really just looking at the whole person, that there's a lot that goes into what makes a person truly healthy. Studies show that the healing arts help patients with physical, mental, emotional recovery. They help to relieve anxiety, decrease pain, reduce stress, reduce loneliness. They provide opportunities for self-expression, particularly at a time when patients may be fearful, there may be a lot of uncertainty. Patients who engage in the healing arts and who have that space to discuss this with their providers report feeling a higher satisfaction with their overall medical care. They report increased self-care skills and an enhanced sense of empowerment. Studies also indicate that healing arts and integrative therapies can fill gaps in treatment effectiveness, especially again for those patients with complex chronic health conditions. So now we're going to dive into some of the different modalities of the healing arts, and then we're going to go into some of the integrative therapies as well. So art therapy. Art therapy is a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. Art therapy is facilitated by professional art therapists. So professional art therapists carry a master's degree in art therapy. Their training includes training in the creative process, psychological development, group therapy, psychodiagnostics, research, and multicultural diversity. They are required to complete 600 hours of supervised clinical internship. Clinical applications. So art therapy has been shown to improve cognitive and sensory motor functions, foster self-esteem and self-awareness, cultivate emotional resilience and enhance social skills, as well as reduce distress. What about music therapy? So music therapy is clinical and evidence-based use of music interventions to accomplish individualized goals, once again, within that therapeutic relationship. It's facilitated by professional music therapists who hold a bachelor's degree or higher in music therapy. Their training includes 3 areas of musical foundations, clinical foundations, as well as music therapy. They're required to complete 1,200 hours of clinical training, including a supervised internship, and graduate programs are also available. There is a national board certification for music therapists as well. Clinical applications. Music therapy can promote wellness, manage stress, alleviate pain, again, facilitate that emotional expression, enhance memory, improve communication, and promote physical rehabilitation. I know we're just zipping through these, but again, just kind of a high-level overview of these different modalities within the healing arts. So moving on to dance and movement therapy. Movement to promote emotional, social, cognitive, and physical integration of the individual for the purpose of improving health and well-being. So dance movement therapists, again, there is a certification for them, and there is a master's degree. Clinical applications improve self-esteem, body image, helps develop effective communication skills, expands movement vocabulary, gains insight into patterns of behavior, creates new options for coping skills. There's whole body research as well, just within trauma, of the benefits of movement healing, of movement to help heal and process trauma as well. And so what about poetry and writing? So this is the use of language, symbol, and story in the therapeutic, educational growth, and community building capacities to facilitate personal growth, healing, and greater self-awareness. There's no master's degree program for poetry or writing therapy here in the US, and so most facilitators are trained through mentorship. And then I also wanted to just include here this idea of narrative medicine and this field of narrative medicine, which is writing and reflection practices for clinicians to better understand their own experiences as well as their patients' experiences and perspectives to deliver effective healthcare. I wanted to mention that and include that in here because, like I shared within my story towards the beginning, often it is our journey, our own journey as healthcare professionals and our wellness that can often lead us into some of these different avenues as well. And there is this field of narrative medicine that is specifically designed for clinicians to help us with our experiences, to help us process our experiences, to provide more effective patient care as well. So I actually had an opportunity to attend a narrative medicine workshop earlier this year as part of the American Medical Women's Association annual conference. Drama and theater therapy. So this is an embodied, active, and experiential practice of drama and/or theater to achieve therapeutic goals. This provides context for participants to tell their stories, to set goals and solve problems. Again, just another avenue for expression and to actively explore their inner experience. So that was a quick run through of different healing arts modalities. Now we're going to dive into some integrative and complementary therapies. And I'm running through this section based off of and sort of in a format based off of an article that was published in Pediatrics in 2017 that was specifically focused on integrative and complementary therapies and different categories. So one category of integrative and complementary therapies is natural products. So this includes things like botanicals, dietary supplements, probiotics, vitamins, minerals, special diets, right? Now, something to know about this, right? Dietary supplements, botanicals, vitamins, herbs, minerals, they are not regulated by the FDA, right? So again, just being mindful of that. And there are so many out there, so way too many to get into in this grand rounds. So I wanted to share a really useful resource for you, which is the National Center for Complementary and Alternative Medicine. And actually, that's a great resource for the rest of the topics that I'm going to cover today. But specifically with this topic of natural products, they have like an A to Z listing of different herbs, vitamins, minerals, supplements that your patients may be using. And they have like a really nice kind of concise, very easy to read through, like one pager on each about kind of what you can use it for. Are there any side effects? Does it interact with any, conventional medicines? What does the science and research say about it? So that's just a great resource to kind of keep in your toolbox or keep bookmarked on your office computer. Also important to know and always important to ask about these because not only are they not regulated by the FDA, but also some have the potential to interact with allopathic medications, prescription medications. And so you want to know about that because some can, increase the effects or they can downregulate the effects. And you want to know that with relation to the other medications that you are prescribing to your patients. And then mind-body practices. So this is my sweet spot. So mind-body practices, we're looking at it here today in sort of three sort of subcategories here: manipulation, mind-body therapies, and whole medical systems. So manipulation, so that includes things like osteopathic manipulation. So that our doctors of osteopathy are trained in. Chiropractic care, so chiropractors, again, focusing sort of on the musculoskeletal issues. Massage, done by massage therapists, again, focusing on musculoskeletal stress relief, lymphatic drainage, myofascial release, so a lot of different things there. And with many of these mind-body practices, as well as the healing arts, there's really little to no side effects to these. And then mind-body therapy. So this includes a whole range of topics. Again, I could spend days talking about this. Like I said, that is my sweet spot. But for right now, I just wanted to kind of give you a list of different names and what sort of things fall under this category. So things like yoga, mindfulness, meditation, Tai Chi, Qigong, clinical hypnosis, different from hypnosis for entertainment, very different. Guided imagery or visualization, biofeedback, progressive muscle relaxation, acupuncture, and biofield or energy therapies. So I wanted to give you an example in practice here of this. Because like I said, it can be hard to maybe know how to facilitate these conversations and discussions within the office. And I want to give you an example that I've used many times in my clinical practice as well. And that is breath work for anxiety. So how many of you have seen an anxious patient before or a parent? Anyone? So this is something that has come in really, really handy for me, and I've used it quite a bit. It takes no more than 1 to 2 minutes, and I have seen it drastically shift the energy in the room, the stress levels, the anxiety levels in the room. Okay. So what is breath work, right? We're breathing all the time, right? But it's the conscious and intentional use of your breath to affect your physiology, essentially, your physiology and your mind. And so we know that, you know, when we feel stressed or anxious, what do people often say? Take some deep breaths, right? But actually, it's your exhale that promotes and activates your parasympathetic nervous system, right? Your inhale activates your sympathetic, fight or flight. Your exhale activates your parasympathetic, rest and digest. So really what you want to focus on is extending your exhale slightly longer than your inhale. And that will help to promote and get you into your parasympathetic relaxation response. So this is what I've guided so many patients through, both when I was working in general pediatrics as well as in the urgent care setting, where I would see kids come in, all ages, from like 8 years old to teenagers, coming in with either coming in specifically with anxiety or coming in with for a workup, right? We do a workup, they're feeling short of breath or chest pain. We do the workup, we do the medical evaluation, everything is normal. I get more of their story and we, you know, realize together that this is related to anxiety. And so I say, breathe with me. So I want you guys to breathe with me. So you can keep your eyes open, or if it feels more comfortable to close your eyes, you can do that too. So just, if you feel comfortable closing your eyes, go ahead and do so. If not, that's fine. Just kind of gaze, keep your gaze soft and low just to kind of minimize distractions here. Make sure you're comfortable in your seat and just take a big breath in and out. And then we'll start together. Breathe in, 2, 3, breathe out, 2, 3, 4. Breathe in, 2, 3, breathe out, 2, 3, 4. Breathe in, 2, 3, breathe out, 2, 3, 4. Breathe in, 2, 3, breathe out, 2, 3, 4. Just allow your breathing to return to normal now. If you had your eyes closed, whenever you feel ready, you can open them up again. How did that feel? So when I do this in the office, I just tell the patient, I said, we're just going to breathe together. And often the parent joins in, right? If you're doing it with their child, often the parent will join in. They're in the same room. And so we're all doing this together. And it's just amazing. I mean, that took, I didn't check my watch, but I would say that was probably a minute, no more than 2 minutes, right? So even in our really busy clinic days, that's just a little tidbit or nugget that you can begin to introduce if it feels right. And then whole medical systems. So what are whole medical systems? So whole medical systems are, as it's described, kind of these entire medical systems within themselves. So that's like traditional Chinese medicine, Ayurveda, naturopathy. What that means is that they look at health, your body, taking care of your overall well-being. They have an entire system and framework around it that is completely different from our Western allopathic framework, right? So often, and I can speak best on Ayurveda, as I mentioned earlier, that's where my training lies. I'm an Ayurveda lifestyle consultant as well. And so, you know, Ayurveda is, so I'll just use that one as an example. So Ayurveda is actually the ancient medical system of India. And I often describe it as the first lifestyle medicine. So you may or may not be familiar that there is a field actually now called lifestyle medicine. There's an American College of Lifestyle Medicine. It was originated in 2004. There is a certification for it as well. And it has really gained in membership over the past 5 years, I would say, but it really looks at different pillars of lifestyle to help promote health and well-being. And so Ayurveda does a very similar, it sees your whole physical, mental, emotional as an entire system. And what you do is there's a series of lifestyle habits, daily routines, diet, activities, detoxification programs that help restore your entire system in balance. And in Ayurveda, we say that the improvement and resolution of physical symptoms is actually a byproduct of restoring your entire system in balance. And I believe traditional Chinese medicine works in a very similar way. So it's really kind of tapping into your own body's natural innate sense of healing, but by optimizing the entire system throughout. So what about access to these therapies? So most of these therapies are cash-based and not covered by insurance, right? And we do have here at CHKD music therapy and art therapy. But like I said, most of these therapies otherwise are patients seeking them out on their own. They are private therapists or consultants or practitioners and cash-based fee for service. So what's our role? When I was going through the numbers, and I didn't put that in the slide, so I don't know the exact number, but there was a significant proportion also in that study that reported that patients, a significant number of patients, don't feel comfortable disclosing their use of these therapies to their healthcare providers. They feel like it just won't be received well. They feel like they'll be judged. So a lot of people are not actively disclosing this information to you, right? And that's why one of my intentions with today's presentation was to help increase our vocabulary, right? Maybe we can't do a deep dive into each of these topics, and that is completely fine. But can we at least make it so that our patients feel comfortable, or do our best so that patients will feel comfortable to disclose this information to us? Asking open-ended questions. What other things are you doing? What does your day-to-day life look like? What other activities do you enjoy doing? Are you doing those? Right? So that we can, as you know, so much of the healing goes on within the communication, within the conversation, right? I trained here at EVMS when Dr. Don Lewis was here. He talked about that all the time, right? It's something I'll never forget. It was such a big thing that I learned from him. You learn the most through taking your history and through talking to your patient. So awareness is the first step to training yourself further and to encouraging this bidirectional communication and this patient-physician collaborative team approach to holistic care. And then lastly, I wanted to just mention this idea of social prescribing that we've grown interested in here at the foundation. Social prescribing is something that is done in many other countries right now. So it started in the UK, but is also practiced in and part of the healthcare system in Canada, Japan, Australia. And what it is healthcare providers actually prescribing some of these modalities of healing to their patients, right? And it's actually built into their system. So I'll use the UK as the example. Again, that's where this has started. So a great model there that I can speak from is that the healthcare provider, the physician, healthcare provider will put in a referral for their patient to receive some of these therapies. That referral then goes to a link worker. So there's a specific role within the healthcare system called link worker. These link workers then go to the patient's home, meet with them, talk to them about what their interests are, what do they enjoy doing, what do they not enjoy doing, what do they need, and then they help link them up with those services within the community. That could be joining a community garden. It could be going to an art class. It could be going to a dance class. It could be volunteering for an activity, right? So really just an interesting idea and thought to kind of round out today's presentation of just another way that we potentially in the future could move towards really integrating some of this more within our healthcare system. Here are some resources. As I mentioned, the National Center for Complementary and Alternative Medicine, that is part of the NIH, so great resource there. I also want to draw your attention to the Peace Out portal that is actually created through the foundation, the Benjamin Goldberg Foundation. That is where there are a few resources here, both for yourself as well as your patients. So as I mentioned earlier, every month I am reviewing scientific literature and writing articles that are just very accessible, both to us as well as to our patients, about different healing arts and integrative modalities. And then we also have short snippet videos of some of the different modalities. So for example, I myself have recorded, there's a short meditation on there that I guide people through. I guide you through a chair yoga practice. We have an art therapist who guides you through like a 5-minute art therapy practice. We have music. So just a great resource also with these short videos that you can access, and that can also be a great resource for your patients to get some of that, just a little snippets within their day. I mean, say a parent is here inpatient, something for them to look at, something for them to be guided through to find some calm, to find some relief within their day. And then I also wanted to mention, we are actually putting together, as I mentioned, today was kind of a high-level overview of all of these modalities. We are starting an annual conference called Healing Arts in Medicine. And each year, this year will be our first year, but each year we plan to focus and do a deep dive into a specific modality. And this year we're focusing on music in medicine. And we have a really great lineup of speakers. A couple of them are from CHKD, and that's going to be on September 30th, right here on the EVMS campus. It is available for 3 CME credits. We have Dr. David Meyer, who is a CHKD pediatric psychiatrist. He's also a violinist, and he's going to talk about music and how it affects the brain, just the neuroscience behind it and how it affects the brain. We have Chris Bird, who is CHKD's music therapist. He's going to walk us through what a music therapy session really looks like. And then we have Dr. Sidel Ross. Dr. Sidel Ross is a hospice and palliative care physician based out of New Jersey who will be coming down. She is also a singer, and she sings to her patients as part of their end-of-life care. So she's going to share more about that. And then we have Danielle Cavazos and Megan Buman. They are co-founders of Tidewater Music Therapy, which is a private music therapy practice based out of Yorktown here in Hampton Roads, and they're going to share what music therapy looks like in private practice. So a really great resource. If you haven't already scanned that QR code, scan that QR code. Go ahead, pull out your phone and scan that QR code, because I am going to switch the slide soon and register for that. We will, of course, have breakfast, and we have some amazing exhibitors as well. And then I'm going to keep it up for another second, but then I'm going to go to the next slide with my contact information, and I would love to open up the floor for any questions. Any questions virtually or in person? Yes.
Hi, I'm in the first line. So we learn a lot about at the same time, we also found negatives for me, for the patient. And Technically used in the traditional sense of how retired doctors often. They do a lot of, as you would call it, they do it in a rotational fashion versus us who wants to do it in a different way often that much like things for the patient. But once you practice have been found where you have to inform someone that's more of the things to be very interesting here.
Yeah, great question. So the question, again, because I think our friends who are joining us virtually were not able to hear. So, so the question is that you're trained in osteopathy and have learned about some of these modalities, but also some of the negative effects of some of them, and just to be wary and vigilant of that, and to be able to counsel your patients on that. Absolutely. And like I said, many, not all, many of these have little to no significant side effects, but that doesn't mean that they don't have side effects, right? Or negative effects. Again, my sweet spot being the mind-body therapies, I can speak more to that. You know, one thing that is honestly a big sort of pet peeve, I guess, of mine is there's so many people out there, you know, teaching meditation, teaching yoga, teaching mindfulness, all of that, all of it, while there is research that shows that it can help you process and move through and heal from trauma. On the way there, it can also activate some of that trauma and those experiences and those memories and those emotions. And so you need to be with someone, you need to be working with someone who is aware of that and who can, with that knowledge and in a really trauma sensitive way, guide you through that process, right? Which is definitely an interest of mine and an approach that I take when I'm working with people in that area, right? So that being said, even something as seemingly benign as yoga, meditation, and mindfulness, which has become very much more mainstream and commonplace these days, which is really exciting for me because I started this in 2002 when it was not mainstream as mainstream. But even that can along the way sort of trigger and bring up these traumatic experiences that need to be worked through. And you need to make sure that you're working with someone who can help guide you through that. So that's just one example that I can share with you, just a really tangible, realistic example within my own experience. But that is important. And so I think it's also really important. That's part of the reason that obviously with mind body, and some of the other practices, I didn't get a chance to go over specifically all of the training just because there are so many modalities. But I did do that with the healing arts of just kind of going through just like, what is the training that goes in there? Because I wanted you guys to be aware of that as well, to know that like when we're referring our patients or when our patients are disclosing to us that they are engaging in these modalities, you know, making sure that they feel comfortable with the practitioner that they're working with. And that they are informed in the specific areas that you're working with your patient on. Yes.
Yeah, thank you for this really helpful talk. We're really becoming much more aware of the inequities in our healthcare system. And as we mentioned, many of these therapies are not covered by insurance. How can you expand access to this kind of treatments to those who are less affluent?
It's a great question, and I wish I had a great answer. It's something that we've talked about and thought about a bit as a foundation of how we can do that on our level as a nonprofit organization within our local community. Ideally, hopefully someday, I think it's going to be a long road to this, that idea of social prescribing, and could insurance companies at some point start to cover some of these as part of a social prescribing and referral program? I think it's an important question. I think it's a big question. I wish I had a better answer for it.
Doc, in the chat, Dr. Klasek, did you want to open your microphone and ask a question?
Is it going to come through the?
Yeah, it should have. I thought Steve Lisa could raise his hand. And Dr.
Can anybody hear me?
Yep.
Yes.
Please forgive me for interrupting. I pressed some of the wrong buttons, but I very much enjoyed your conversation. For a history note, I was the chief there 30 years ago. But anyway, y'all have a wonderful day.
Dr. Harrington, did you want to ask your question?
No, it's always nice to see one of our residents come back and give a talk. So I just wanted to know, I know you're talking about this for our regular patient population, but we've been utilizing CAM therapies and, behavioral and anxiety, decreasing behavior therapists for kids with autism. Since I started in a lot of the complementary and alternative therapies, started out, a lot of them started out through, through the autism, the mushrooming of, things and stuff. And so, we had to kind of flex it back from alternative therapies back to complementary. And so can you give me a little bit? Some people sort of kind of go down those rabbit holes and then start doing a lot more stuff that are not necessarily evidence-based. So how do you work with that sometimes when they're doing both things, but you want them to focus on the evidence-based ones?
Great question, and great to hear from you, Dr. Harrington. And yes, my first 2 years out of residency, I was working in neurodevelopment, specifically with populations with autism, ADHD, and from that time also, I was like, there is a place for these mind-body practices here. But great question. I think it comes back to just continuing the conversation with your patient and really explaining to them some of those differences that I talked about earlier of well, these alternative therapies are not based or rooted in evidence. And, because also they're just seeking a solution, right? They're just seeking a solution. So then if we can inform them of those ones are not evidence-based, but these ones are, and there's this whole list of other things that you could try, that you can try, that is rooted in evidence to supplement and augment the treatment that we're doing here together, right? So maybe it is just continuing that conversation and presenting it in a way where we are giving them an alternative, right? Because they're just looking for solutions. And so now we are giving them the evidence-based alternatives for that. Does that answer your question, I hope?
Sure. A lot of times we utilize like the kind of set. Does it do harm, and is it helpful? Does it not do harm? Is it helpful? Does it do harm and is not helpful? So then we're probably not going to advocate for that. And I sort of go through those types of things with them.
Yeah, absolutely. Absolutely. Great. Well, I did say that I would share my.
Click on the mouse.
There we go. So this is my contact information. If you do have any other questions, comments, feedback, any of that, I welcome it. So my email address, sheetal@benjamingoldbergfoundation.org. I'm on all the socials, LinkedIn, Facebook, Instagram, all of that at Sheetal Ajmani MD. So please connect with me there as well. And thank you so much for your time this morning. Thank you for joining us here today.
Could I have the CME slides? Doc, could I have the CME slides? Yeah, thank you.
And then this is how you can claim CME.